We're looking here at Hudson Headwaters and across the Adirondacks in the New York State to really transform the way we deliver health care to our patients.
How can you explain kind of what a medical home is?
Well, some of the key concepts for medical home is that it's patient-centered, and the patient actually chooses a provider who they want to be the person to coordinate all of their health care, not just their primary care, but all their health care across all the different spectrums, whether it be in the hospital, specialty care, end-stage dying, you name it. One doc who kind of knows everything about them and helps them to navigate through this kind of a really difficult healthcare system that we've got here in the United States.
It's so interesting that it's in our region. You know, we live in a rural region where historically there had been a shortage of primary care physicians. You know, has that changed kind of with the medical home project?
Actually, that's what brought the Medical Home Project to the Adirondacks, because we did have a shortage of primary care, and in some ways we still do have that primary care shortage. And what we hoped was to make the healthcare delivery system up here attractive so that we actually would be able to recruit and retain physicians to come up and serve our rural population.
How does this fit in, I guess, to the broader discussion of healthcare reform on a national scale?
Well, you know, I think the hope is, and you know, it's a little bit early to tell the end result here, but I think the hope is that by having information about your patient readily available, what it's going to do is it's going to help in the decision-making process for when the patient presents, but also it's going to help from an efficiency standpoint, because if a patient, say, presents at the emergency room and they were just seen at our health center maybe a week or so ahead of time and had been worked up for a similar problem, all the lab information, all the other diagnostic information, their medications, their problems, and even the information from that visit are available to that emergency room physician. He doesn't have to repeat those tests. He already knows what the patient's on, and he can have a better process in determining where do I go with this patient to make sure that we're understanding what's going on with them.
What is the result for the patient ultimately, you think?
Well, I hope threefold, we like to think. One, that by doing this, that their quality is going to improve because we'll have one area that's really managing everything. Two, that we're going to see that they become more involved with the management of their care. Before the medical home, oftentimes patients were passive recipients of whatever the doctor was telling them that they needed to do. With the medical home, we actually want them to be active participants, and we want to give them the tools and the education and the coaching that they need to become active participants. And we hope that that will make them more satisfied with the care that they're getting. And also, ultimately, the efficiency isn't just on the side of those healthcare dollars being saved from a payer standpoint, but as you know, the dollars trickle down, and they trickle down in the form of your cost of your individual healthcare insurance policy. So if we can lower the cost of healthcare overall, then we should be able to lower the cost of our individual healthcare premiums. Here we are in the United States. We're one of the highest costing healthcare systems in the world. But when you look at our quality indicators, whether it be our infant mortality rates, our rates of smokers, rates of low infant birth weights, we are on the low side of the industrial nation for these quality indicators. So if we're spending so much on healthcare, why aren't we also the #1 premier quality player in town? That's something we've got to change. You know, we've got to improve that health outcomes. We also need to do it more efficiently and save those dollars.